Hello, everyone. I'm Dr. Chris Kingswood, and on behalf of everyone at the TSA, I hope that you and all your loved ones are keeping safe during these very difficult times. As we all work to navigate the new world we live in, the TSA is working hard to provide up-to-date information on coronavirus, along with all our other work for the TSC community. We know that many of you have questions about coronavirus vaccines. Here, I hope to explain some of the details to you. Put simply, no, you definitely can't catch coronavirus from being vaccinated. The vaccines have chemical components that simulate the virus, but they don't contain the virus itself. If you've already had coronavirus, you definitely should still have the vaccine. Coronavirus, if you get over it, may give you some antibodies, and they may last short or a long time. Some people have caught it twice. Based on all the evidence that we have so far, the answer is definitely yes. Doctors have tracked this very carefully, and there seem to be no problems vaccinating someone with TSC. People with TSC may be much more vulnerable to coronavirus than other people, depending on what's wrong with them. So if you're offered a vaccine, any vaccine, then take the first opportunity to have it. This is a complicated issue, so all the details I'm about to share with you are on the TSA's website, and the link will be shown throughout this video. When adults with TSC will be offered a coronavirus vaccination depends on their individual circumstance and how TSC affects them. For example, if they're considered clinically extremely vulnerable to coronavirus and have received a letter from the government, they will be in priority group 4. If you have not received a clinically vulnerable letter, but have an underlying health condition, that means you're at higher risk from coronavirus, you will be in priority group 6. This will cover lots of people with TSC because people with TSC have several underlying health conditions such as pulmonary LAM, kidney AMLs, cysts, epilepsy, severe learning disability. For everyone else with TSC, they'll be vaccinated as part of their relevant age group. If you have TSC and you're living in a care home for the elderly, where vaccination of the whole resident population is recommended to keep everyone safe, including the younger adults living alongside the older residents, they will be vaccinated as part of group 1. Otherwise, it will depend on the relative risk of yourself and the people you're living with. Most children under the age of 16 will not be offered a vaccine at this time. That's because almost all children with coronavirus have no symptoms or a mild disease. That may change in the future in order to protect older people they're in contact with, but we have to wait and see. However, older children with severe neurodisabilities who spend regular time in specialized residential care settings for children with complex needs should be offered the vaccine. If you're an older carer, please do get vaccinated as soon as you're offered an appointment as part of your relevant age group. This might feel strange if you're offered an appointment before the person you're caring for, but it will help both of you to keep safe and help you to keep your other loved ones safe as well. Carers who are in receipt of a carer's allowance, or who are the main carer for an elderly or disabled person whose welfare may be at risk if their carer falls ill, should be offered vaccination as part of group 6. You can keep track of the different priority groups and what they mean for the TSC community on the TSC's website. This will depend on the treatment you are receiving. If you're being treated with an mTOR inhibitor, such as sirolimus or everolimus for AMLs or SAGA, you may wish to speak to your clinician about whether to temporarily suspend the drug. In our own clinic at St George's, we're thinking that we're going to advise people to stop those treatments if they have enough warning a week before the vaccine and stay off them until a week after. If there's less warning, the important thing is to get the vaccine as fast as possible. So don't delay that. If you're taking an mTOR inhibitor for LAM or epilepsy, then it's probably better not to have a break from treatment, but do ask your clinician, your GP or consultant who's looking after you for that condition. This is an important point for many people in the TSC community. It can be very useful to speak to the hospital, GP surgery, or whoever else is offering you the vaccine. You can discuss any reasonable adjustments that can be made. If you're being referred to hospital by your GP, you can ask your GP to check whether the hospital has a learning disability liaison nurse. This is a specialist nurse who helps support people with learning disability while they're in hospital to get all the care that they need. One of the things about prioritization is that this is being set centrally, and the Department of Health is telling GPs and hospital consultants what to do and when to vaccinate which of their patients. So your actual doctor may not have a lot of influence on timing, but they will contact you as soon as they hear from the government where you are on the government's list. Contact the TSA support line to discuss this or any other TSC related inquiry. For any questions related to your individual clinical circumstances, please contact your GP or TS clinician. I hope that this helps you. Remember, you are not alone during this time. I look forward to a time when we can all once again be together face to face. In the meantime, keep in touch with the TSA and be sure to come along to our virtual events. Thank you.